Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to discuss some of the latest trends impacting the industry today. My name is Justine Giancola. I'm with Inovalon, and joining me today is our very own Christie Teigland, VP of Research Science and Advanced Analytics, also here at Inovalon. Thanks for being here today, Christie.
Thank you, Justine. Happy to be here.
So, Christie, you have been connecting with researchers everywhere this year, AHIP, ISPOR, Health, and now Customer Congress. What is the most exciting thing that you're seeing in real-world data analysis across all of these events?
Certainly the explosion of use of artificial intelligence. We just had our Inovalon Customer Congress, and we had two national leaders from Harvard University and Microsoft. And the stories about what you can do, it's really hard to wrap your mind around, but it's really, truly fascinating. And every single conference, there are multiple sessions on artificial intelligence. So, yeah, it's very exciting. But there's other practical developments that are really exciting to me, just based on the research that we do every day with our big data that we have for both life science companies as well as health plans. And that is the tokenization of data. What does this do? It assigns a unique number to patients so that we can link to other data sets that are, give us data that we don't have in our claims data. So we've got clinical data. We know if people had a lab test, but we don't always have the lab result, right? And now we can link to external databases really seamlessly, easily, without going through, sending personal health information across, in secure files. And it was just so much harder in the past. This allows us to link to external data, to pull in, hospital data, lab data, other data that we don't have access to. So I'm really excited about even some of those kinds of developments.
Absolutely. And yes, I second. The AI ML conversation has been, you can't go anywhere without hearing about it. So very exciting things coming up, it sounds like, in the world of healthcare and technology. And we also have some exciting research happening between Inovalon and Harvard Medical School on the differences between Medicare Advantage and Medicare Fee-for-Service. So can you tell us, what do these insights mean for the industry? What sort of impact is this information going to have?
Impact on two levels. One is at certainly the health policy level, because the research that we are doing is very unique. As the Harvard people like to say, we are literally the only company that could probably do this type of research, and that is because of the breadth of data and our ability to longitudinally track members of health plans when they're covered by commercial insurance to when they transition to a Medicare plan. And so we are looking at people for 2 years when they're covered by commercial insurance, and then seeing who goes to Medicare Advantage, who's enrolling in Medicare Fee-for-Service, and after that, what are their healthcare utilization, cost, quality outcomes, really just a head-to-head comparison. And what we've done is very matching these patients so that we've removed all the differences in who enrolls in Medicare Advantage, because the Medicare Advantage population tends to be much more socially disadvantaged. They are more likely to have low incomes. They are more likely to have low education status, more likely to have just a myriad of social disadvantages. And so after you control for that and really compare, patients who look alike, who go to Medicare Advantage and Fee-for-Service, we are finding some very different results than have been previously reported about Medicare Advantage. One of the myths that our data is going to change is that you often see that Medicare Advantage is denying care. And we find that not to be the case because even though, Medicare Advantage beneficiaries end up having fewer hospitalizations, fewer observation visits, fewer emergency room visits, but they see their doctor as much. They take the same number of medications, so the same outpatient visits. So if Medicare Advantage were truly denying care, we would see more hospitalizations. We would see more emergency room visits. So on the policy front, we're really showing that Medicare Advantage and the types of care coordination they provide, preventive services that they provide, really is resulting in more efficient care. We know Medicare costs, you know, a big portion of the budget in the United States. And so it's really important to find out what models of Medicare are working best, are most efficient, have lowest costs, and really result in the best quality of care for Medicare beneficiaries, which is really important. But at the health plan level, we can leverage this data and customize this data to really help health plans understand who's going to join their plan, right? I heard a CEO at AHIP, for example, from a big health plan say, we don't know who's coming into our plan. We do. We can predict that. We know what they're going to look like, which means you can plan, right? You can recruit those members. You can act to retain those members because you can design your benefits to meet their needs. You can figure out, you can know how much they're going to cost, what healthcare utilization are they going to have, what kind of specialists are you going to need to take care of those members, what kind of chronic conditions do they have, and what social needs are they going to have? Do they need transportation? Do they need food service delivery? What are their social risks that are really driving higher costs and poor outcomes? So there are actually going to be lots of applications at the health plan level, such as member recruitment, retention, comparing, benchmarking against your competitors. 5-star quality rating improvement, because we can calculate quality measures and look at the drivers of those quality outcomes. So I think there are really endless applications of this research we're doing with Harvard, and we are going to continue. It's a long-term relationship. We've been working with them for about 2 years, and we're going to work with them into the future.
Okay, that's great. I know a lot of research has been done. Really excited to see what more is coming out. We have published a couple papers. Those are on our website, so be sure to check those out. And Christie, you kind of touched on this a little bit, but as the healthcare ecosystem continues to strive for true health equity, what do you think are some of the biggest opportunities to leverage data in advancing access to healthcare and outcomes?
So I have literally focused on health disparities and health equity for more than a decade. Before, people were really talking a lot about it. And, people have always known it's the right thing to do, I think, and people have talked about health equity and closing disparities. But the pandemic really brought to light the disadvantaged members of our society fared far worse in the pandemic. Their mortality rates were higher. Their outcomes were worse. They were more likely to, get COVID. And it really brought to light the importance of addressing social determinants of health, and which really drives 80% of health outcomes. People are surprised to know that clinical care, the actual clinical care you get, really is only determines about 20% of your health outcomes. The rest is due to your environment, your income, just social risks and social needs. And so CMS is actually finally putting some incentives in place that have dollars behind it to improve health equity. They've introduced a health equity index, and what this index is going to do is actually look at 5-star quality measures that are important to health plans and important to Medicare enrollees, like things like, are you adherent to your medications? Did you get your preventive cancer screening, your breast cancer screening, your colonoscopy? Are you taking, is your HbA1c under control if you have a diabetes? And so taking these quality measures and calculating the performance of your plan for members who are either dual eligible for Medicaid, which is a proxy for low income, or disabled, meaning you joined Medicare under age 65 before you were disabled. They have said they're going to add other social risk factors like income and education later, but they don't have that data. So it's really hard, they can't really stratify that way. But what they'll do is then compare performance on the measures for members with social risk factors to performance with members without those social risk factors. And then you're going to be able to see where are their biggest disparities, because you can then focus your resources on the areas where there is the greatest need. Plans will also get a score. So their scores for members with social risk factors will be ranked against all the other contracts in the nation, and they will get points if they are in the top third. They'll get no points if they're in the middle. They get a -1 if they're in the bottom. This is going to actually impact their 5-star rating, and it's also going to determine their reward factor. This can be worth hundreds of thousands to millions of dollars and more to these health plans. So there's now real dollars behind achieving health equity. And I think that will really motivate some of the plans who might be a little behind on trying to understand and address disparities to really make a difference, to really move the needle. So I'm very excited about all of the national focus on really doing something about health equity, not just talking about it.
Yes, absolutely. And Christie, I know you have been talking about this quite a bit lately, and it's exciting to see the strides that we're taking in this area. So very exciting. And one last question for you. Want to get your thoughts on the shifts that we're seeing in healthcare. There is a much deeper interest in data, connecting the data. Like we said, the influence of AI in analysis and research. Can you give us a prediction on where healthcare data analysis is going to take us in the next 5 years?
Well, it's really tough to have a crystal ball in a area that's growing, changing so rapidly. It's almost changing faster than my imagination can change. And we talked about AI. Obviously, that's going to explode, and the applications are endless and very, very exciting. But there are also many challenges with AI. So it's going to be interesting to watch how all of that evolves. But some more real, again, I like to get down to the practical. So one thing I would love to see in 5 years is I don't have to fill out my health information multiple times every time I see a different doctor. I don't have to give them my list of medications. I don't have to write down my diagnoses. I don't have to, list my family's history of, cancer and all. It's just so frustrating, right? I mean, you hear people say sometimes even in the same building, they go from one provider to the next and they have to fill out the information again on the same day, or you go to the emergency room, you fill it out, and you have to go fill it out again at the hospital. This is really insane with the technology we have today. So let's hope in 5 years that we don't have to manually fill out forms when we see our healthcare providers. The other thing that I'm really excited about is precision medicine. And it is now fairly cheap and fast to map genomes. And what that can do is I've heard so many speakers talk about exciting applications. You have a patient, they present with something that no one can figure out what they have, and they can map the genomes and identify that gene and what is causing the condition that the patient had that they just couldn't diagnose. All the doctors couldn't figure it out. And then you know how to treat it. You can also predict, right, who's going to get Alzheimer's disease, who's likely to get cancer. And so we can really develop prevention, maybe prevent adverse outcomes from happening, improve people's lives, improve the length of life, reduce mortality. So precision medicine is really exciting. That'll be supported by AI, I'm sure, but it's really this really interesting genome mapping that is resulting in finding cures for rare diseases that in the past just no one could figure out, right? So healthcare is really an exciting place to be these days. I'm motivated to come to work every day because I truly feel like I'm making a difference. And while we have a long ways to go, before we achieve the best outcomes possible for all people, which is the definition of health equity. We are on that road, and we've got the momentum, and we've got the incentives in place, and I really believe that we're going to make progress on health equity. So I'm very excited about that.
Yes, absolutely. And I mean, Christie, as you know, that is Inovalon's mission, is we are ultimately trying to improve healthcare, improve those outcomes. That is what it's all about. So couldn't agree more. Christie, it has been great having you here today. Thank you so much for joining us. And for everyone who tuned in, thank you so much. Be on the lookout for our next episode of the INOVATORS series.